economy. Dr. Anita Gupta is an assistant professor at Johns Hopkins University School of Medicine. She tells me there is no one-size-fits-all approach to school reopenings.
Schools should open, as soon as possible. I mean, the economy, families, really want their children to go back, and it's really for the well-being of children. They really need, to get back because of the potential social and developmental risk, that could incur long term. But with that being said, the data is obviously disturbing. We really need to understand what the long-term impact is, on children, and that's unclear. We really don't have clarity on what can happen in children. And so, the jury is really out. What can happen, and we really need to have better research, and that's not there yet. What can happen when the flu season occurs? What happens when children begin to congregate in small classrooms, and what's the long-term impact? So until we have that information, there has to be, parents need to be comfortable, professionals and doctors need to have better information. So that's where we are right now.
Should schools prioritize certain kids over others when it comes to reopening? What comes to mind for me is students with special needs, students that rely on schools for food. These seem like pretty essential to get them back in the classroom. What would you recommend?
Look, this is, again, not a one-size-fits-all, very complex issue, and we don't have all the answers right now. And not only those populations of patients, but certainly there's a digital divide that exists. There's children that don't have resources right now for computers or virtual learning. So among those children plus the digital divide, many unanswered questions. In addition, what will the flu season look like when we begin? So how will that impact students, and what will the policies look like if the schools have to re-shut down? So it's a rapidly changing situation. It's unpredictable, and we need better accountability. We need to have better responsibility from the schools, and certainly more questions than answers at this point.
Dr. Anita Gupta, thank you so much for your time. I really appreciate it.
Thank you.
Coming up,